On today's topic, I want to talk about the things that a pregnant woman should do to avoid having miscarriage. All of us, we understand that miscarriage is the worst thing that can happen to a pregnant woman. And of course, no one would want that. Every woman would want to carry the pregnancy until or up to the last date. Yeah, but sometimes there are things that we indulge ourselves into but we end up like contributing to miscarriage. And what are those things that a woman should do to avoid uh, a miscarriage? Point number one, or rather what you need to understand is that miscarriage is a spontaneous termination of pregnancy. Okay, and miscarriage usually happens during the first 20 weeks of pregnancy. Miscarriage, all of us we know that it is a sad event for parents, and although miscarriage cannot totally be avoided, there are still things that you can do to avoid or to prevent or to reduce the risk of miscarriage. So below, I'm going to give you the things that pregnant woman or you as a pregnant woman you should do to avoid miscarriage, okay, or to avoid having a miscarriage. Otherwise, welcome on board. My name is Lab Doctor 254. I am a counselor. I talk generally everything to do with love, relationship, marriage, and of course, sex issues. So, allow me to go straight to the point and dictate the following. Point number one is avoid known miscarriage risk factors. Avoid known miscarriage risk factors. What do I mean by that? Many women drink and some women even smoke and occasionally indulge in the use of drugs. Yeah. Before getting pregnant, make sure you stop taking these drugs. That is alcohol and other drugs. Okay? Some women continue taking alcohol till they get pregnant, and that is very dangerous because the three things mentioned above are known to increase a pregnant woman's risk of having a miscarriage. So you are there, yeah, you are there, and you're still taking or using drugs. It is really, really, really unfortunate, and you should stop it with immediate effect if you don't want to have miscarriage. The other point is reduce your caffeine intake. Okay, although caffeine has those health benefits, pregnant women should reduce the intake of caffeine or rather caffeinated drinks. Okay, okay, or completely stop drinking caffeinated drinks. Okay, that is something like caffeinated coffee. Okay, because aside the fact that it increases the risk of miscarriage, it can also cause birth defects and low birth weight. Please note that. Reduce the intake of caffeinated drinks because as much as it is inducing miscarriage or rather it is contributing to miscarriage, it can also cause birth defects and low birth weight. Okay. The other one, point number three, is that seek prenatal care. Okay. Prenatal care is very crucial, and all of us we know that. Yeah, you as a woman, a pregnant woman, yeah, or even you as a listener, as a man, you need to advise your woman, or rather, you should be aware that when your woman is pregnant, prenatal care is very important. Prenatal care is popularly referred to as antenatal, yeah, or rather in our country, prenatal. Okay, the healthcare pregnant women, yeah, the healthcare pregnant women get during the duration of their pregnancy is called prenatal care. We all of us understand that, and it is very crucial. In order to prevent miscarriage, pregnant woman, yeah, should seek prenatal care from a good hospital immediately they get pregnant. That one you should note that. Okay, the other one is eat healthy foods. Okay, having it's not okay. What we mean by eating healthy food is that this food is key to preventing miscarriage. Even before getting pregnant, women should be eating healthy foods like whole grains, vegetables, fruits, proteins rich foods, okay, fiber rich foods, yeah, things like things like iron related foods, yeah, and also they should avoid low fat dairy and raw fat dairy products, okay. Make sure you continue taking these foods when you still get pregnant, because it will boost your body, it will help your body. You know, you are carrying a living thing, or you have another thing that you are carrying that is in need of, and this kid or this born unborn baby requires you. Whatever you feed, you're still feeding the baby. So you can imagine, if you feed poorly, what will happen? At the end of the day, you will initiate, or rather, you will contribute to miscarriage. The other one is take multivitamins. Yeah, certain multivitamins are important during pregnancy. What do I mean? Multivitamins like folic acid are important because, yeah, they help prevent miscarriage, among other things. In fact, women are advised to start folic acid, that is, they are advised to take folic acid before even getting pregnant. Yeah, you'll hear your doctor prescribing to you. Do you have daily multivitamins for you during antenatal sessions? You will hear your doctor telling you, or advising, or acknowledging that idea of using multivitamins. Okay. The other one is avoid infections. Yeah, infections like gonorrhea, syphilis, yeah, chlamydia, etc. Yeah, yeah, can result in miscarriage, or increase a pregnant woman's risk of miscarriage. So if you aren't sure of who you are doing these things with, or you're having sex with, it is important that you use protective measures. The moment you get these infections, they will increase, or rather, they will have higher chances of miscarriage. And remember, no woman would want to have miscarriage. Okay, although we cannot really say it is preventable like 100%, there are things that you can do at a personal level to avoid such scenarios. Okay, make sure you treat all the infections you have before getting pregnant, and protect yourself from infections during pregnancy, because even imagine, even malaria can increase the risk of miscarriage, or have a higher chance of increasing miscarriage. Okay, the other point is regular exercise. That is point number 7. Regular exercise. Of course, even you who is not pregnant, you know the benefits of exercise. Yeah, we all know the benefit of exercise. Now here I'm addressing this pregnant woman, or you as a pregnant woman. You should now do take or rather, issue with exercise should be part of you. Regular exercise before and during exercise or during pregnancy can reduce the risk of miscarriage. During pregnancy, avoid stressful exercise. Of course, we are not really talking about those stressful, of course, there are those stressful exercise. Yeah, and especially for us men, sometimes we go to the extreme edge. So, what I'm talking about is things like walking, swimming, yoga, and riding stationary bikes are the best exercise for pregnant woman. Okay, so ladies and gentlemen, you are there, you are pregnant. I hope I have given you good advice in relation to miscarriage. So if you do the following, then you as a man, yeah, do the necessary that you can, or do the things that you can manage. Don't indulge in fights with your woman. Don't make your woman get into position of being stressful. Okay, just take care, nurture your woman in the best way possible. Okay, and you as a woman, there are those things that you have mentioned there, they are at a personal level. You are the only person who can determine the magnitude and the level, or the chances of miscarriage. Otherwise, ladies and gentlemen, see you in the next video. That comes the end of my session. Thank you.